Assalamu alaikum, the communication day. First scenario, Mr. Sami, 50 years old, admitted with nausea and vomiting. The test result showed potassium of 7. He need urgent dialysis. Mr. Sami has past history of hypertension since 5 years. Please discuss with him possible methods of renal replacement therapy and address any concern. Ready?
Yes, Dr. Basim.
Here you go.
Take your
Hello.
time. Okay. Hello,
Yes.
doctor.
I'm Dr. Abdul Karim. I'm one of the doctor covering the service today. May I confirm that you are Mr. Sami, 50 years old?
Yes, doctor. I'm Sami.
Mr. Sami, we are here to talk regarding your health condition. Is that okay with you?
Yes, doctor. Sure.
Just to be in the same page, could you tell me how much you know regarding your health condition?
Yes, doctor. I have been complaining from tummy pain and feeling sick and being sick. I vomit many times. So I came to the hospital yesterday. The doctor here there admit me in the hospital, and she take from me some blood test and do some scanning to my tummy, and I am waiting the result. I wanted to know the cause.
Okay, so I'm sorry for that, Mr. Sami, and thank you for sharing this information with me.
Thank you,
Do you have any expectation about what is going on?
I afraid doctor really to have any problem in my kidney like my father.
I'm sorry for that, Mr. Sami. Actually, yes, you have a kidney problem.
Oh, doctor.
But yeah,
It is very
we
bad.
did.
It is very bad news, doctor.
I'm sorry for that. I know this is very hard news for you today, Mr. Sami. Actually, Mr. Sami, the result now with me of the blood test that was done for you. I'm sorry to tell you that it's not good.
Oh, doctor.
Yeah.
What is the problem?
It shows that your blood, you have high level of the salt, which you call potassium in your blood.
So, doctor, I have increased the salt or any kidney problem?
Yes, apart from this, yes, Mr. Sami, also you have your kidney affected. I'm sorry to tell you that. So when, have you heard about the kidney it failed to functions?
Yes, doctor.
Or
My
kidney
father.
failure?
Really, doctor. Yes, I know my father suffered more about his kidney. I don't know why, doctor. It might be, doctor, familiar condition.
Mr. Sami, until now we are not sure what regarding the cause of your kidney. Now it might be due to family, the condition run in family. But I can see that from your note, Mr. Sami, you have high blood pressure since 5 years ago. Am I right?
High blood pressure? No, doctor. No one tell me
Yes.
about that. No one
I'm
told
sorry
me
for
about
that.
that, doctor. It is me, doctor. Are you sure I am the one in? It is my notes. Because
Yes.
I don't have any blood pressure, doctor.
Before you are not diagnosed with high blood pressure before?
Never,
or you
doctor.
didn't take any medications?
No, doctor. I remember that I came to the hospital. I think since many years. And the doctor I have some headache, and the doctor not tell me any of that, or never give me any medication for blood pressure.
I'm sorry, we apologize a lot for you. Actually, Mr. Sami, this is not our usual practice. Usually in our practice, when the patient having any conditions like this high blood pressure or any other illness, we should discuss with him more regarding his conditions and regarding the further management plan.
So, doctor, might be this blood pressure the cause of my kidney problem? So I think, doctor, it is a mistake from the doctor not tell me about my blood pressure or giving me any medication. So I think it is a mistake from him.
I'm sorry for that, and we apologize a lot for you, Mr. Sami. Yes, sometimes the blood pressure in the long, if it can for long standing, and if not controlled well, it can damage the kidney. Regarding Mr. Sami, is it mistake or not? Just let me to go back to your file and to check and to discuss with you after that.
Okay, doctor.
Yeah, and be
Okay,
sure
doctor.
that we are going to raise incidents report for what happened for you.
Okay, doctor. I want to complain against this doctor. Not tell me that I have high blood pressure. So I want to complain, please, doctor.
I'm sorry again, Mr. Sami, but if you give me a chance just to go back to your file, and after that, if there is any issue of mistake, you have a right to complain. And even we can guide you to a patient advice relation office that it can help you to raise your complaint. Is
Okay,
that
doctor.
okay?
So what will you do for my kidney problem?
Yes, so our team, our consultant, after assess your condition, they decide that, yeah, your condition now need urgent or necessary um, for renal replacement therapy. This is, yeah, it have
Mhm.
many options. One of them is hemodialysis. Have you ever heard about it?
Yes, doctor. My father in hemodialysis. So it is very bad experience, doctor. I can't do this, doctor. Give me any medication other than this machine. I know this
I'm sorry.
machine. I came with my father 3 days a week, and they give me and wait for many times to on the machine. He suffered more, doctor. Please give me
I'm sorry.
any other option.
I'm sorry for suffering of your father. I understand your feeling and your worries regarding your conditions.
Thank you,
But
doctor.
Mr. Sami, yes, now this yeah procedure, it is the most necessary and most important for your conditions, because as I told you that as we discussed before, you have high level of this salt, and this it can
Mm-hmm.
affect your heart and can be risky for your heart, and even it can be like life-threatening conditions. So we
Mm-hmm.
need to do it as soon as possible. So
Mm.
may I discuss with you more regarding this?
Yes, doctor. Sure.
Okay, so regarding this hemodialysis, just we need to prepare you, and we need also to check your blood to make sure that you are fit to do for you this procedure. And yes, this will be needed, yeah, just like filtration of your blood from this high potassium and other toxin in your blood. This we need to connect you through the tube, either in your neck, through the blood vessels, large blood vessels, either in your neck or in your hand, will be connected by the machine, which act as the artificial kidney. This will
Mm-hmm.
filter your blood, and after that, it can return your blood back to your body.
Yes, doctor. I know. I
So,
know. I know this. Any other option, doctor? Please. I don't do this. I don't do like this machine. Any other
uh,
option?
I highly appreciate your feeling, Mr. Sami. Just in yeah, in like urgent situations, we best to do this. But yes, there is another option which is called peritoneal dialysis.
Mm-hmm.
This just will insert tube in your tummy wall, and will inject some fluid, and after that, this it can filter your blood, and it come back after a while. But
Okay.
this it can be, yeah, even
2 minutes
used
left.
in your home.
Mm.
So, Mr. Sami, what do you think regarding for starting this
Yes, doctor. Peritoneal dialysis
hemodialysis?
is good, I think. But doctor, what if not going to dialysis? You can give me any medication?
Mr. Sami, I'm sorry for that. Your concern is valid, but the hemodialysis is the most important for your condition now, because if you don't do it now, this collection of toxin and the fluid in your body,
Mm.
it can be harm for you, and also this
Mm.
high potassium in your blood, it can be risk for your heart, and it can cause disturbance in the electrical disturbance in the heart, so it can lead to life-threatening condition. It might be even it can put you to yeah, and it can cause for you like yeah, uh, very serious conditions. So just
Yes,
we
yes,
afraid
doctor.
from that.
Yes, doctor. Can I do kidney transplant?
Mr. Sami, yes, regarding the kidney transplant, Yes, it might be one of the options, but first, in the like this urgent or emergency situation, we need to correct your blood from this toxin. And after that, if your condition not it become better, we can sit with you or we can discuss with you another options like this renal transplant.
Okay, doctor.
Is that okay?
Yes, okay,
Okay,
doctor.
so do you have any concern for me?
No, doctor, thank you.
May I ask you, what you are doing for living?
Yes, doctor, I'm a teacher.
Okay, how much your condition impact your job and usual daily activity?
Yes, doctor, I think it impacted me a lot, doctor.
I'm sorry for that. I will try to help you regarding this problem, and even we can provide you sick leave for these living days until your condition become more better.
Okay,
So do you
doctor.
smoke?
No, doctor.
Do you drink alcohol?
No, doctor.
With whom you are living?
Yes, I live with my father.
Okay. So anyone, be able to take care regarding you and your father?
No, doctor. We need support, me and my father.
I'm sorry for that. So we can post your name for social worker to see if they can help you. Is that okay?
Yes, doctor.
Okay.
Okay, thank
So
you.
okay. So I'm sorry again for what happened for you. We will provide you with brochures and trusted website to read more regarding your conditions. And this is the contact number of our department. If you have any worries or queries, please don't hesitate to ask us.
Okay, thank you.
Okay,
Thank you.
time is up. Okay, thank you, Dr. Sarah. I always add some minutes, some seconds to cover all concerns and to know how to do. But in the exam, they will not give you any chance. Whenever the bell will ring, you will go out.
Okay.
Now the comment, Dr. Mahmoud, please.
Yes, actually, Dr. Basim, it is a long scenario. I know that. It is very long scenario, but I think Dr. Sarah did it with good manner. First, I think I don't know why Dr. Sarah at the beginning hesitating. So we have not good news. What I have, doctor? Yes, you have a kidney
Actually,
shutdown.
because I didn't. Yeah.
Yes, I really, Dr. Sarah, I bring this. My father has hemodialysis now while I talking with you.
Yeah.
Because I wanted to hear from you the expectation that I am sorry for your for your father suffering. And then, yes, I think I have some bad news for you. What doctor? Yes, you have also a kidney problem or kidney shutdown. And as well as there is some salts in your body. It is elevated, can cause can cause some harm effect on your heart and your body. So, doctor, what is the cause? I will tell you what is the cause, doctor, of this condition. It is familiar condition. No, it is one of the causes. Might be familiar condition, but I can see from your notes that you have hypertension. So, doctor, no one to tell me about that. I am sorry. I am sorry about that. I can't judge about this situation. Okay, I will go back to your file and see what happened. I will see, no, doctor, I come to the hospital many years back and doctor not tell me. You should tell me, okay, why you come to the hospital? I will see you, I come to because of a headache and any blackout like that. You tell me I am very sorry for that. It is not our usual practice. However, I will go back to you, check your file, and if there is any mistake or anything, I will update you later. Okay, doctor, I want to complain. It's your right. I will guide you to the patient advisor service. They will see you. Okay, and then doctor, what will you make for my kidney? Yes, we have many options for you. The first one, it is hemodialysis, but brief because no time. It is hemodialysis. I know it, doctor. It is my father also has hemodialysis. I am very sorry for your father suffering, but it is the best mode of dialysis because it can improve the toxins and the excess water rapidly, so you will feel the improvement fast. So, doctor, any other modality? Yes, we have another modality. It's called peritoneal dialysis, which we fix a special type of needle into your tummy, and through your tummy, it act as like exchange membrane. We will introduce a special type of dialysis. Of fluid called the dialysis fluid. Through this membrane, we can exchange excess water and toxins through this membrane. But it needs some circumstances, and we will refer you to the specialist nurse to learn how to dialysis in home. But I think at the time being, there is some salts in your blood called potassium can stop your heart. And we need a faster we need to remove this salt from your body very fast. So, doctor, what do you think about kidney transplant? Yes, it is the best choice in your condition, but also there is some circumstances that should be taken before kidney transplant. We should find a donor from the organ bank. But it will take time to find a donor. So now it is the best method to remove this salt and remove excess water, and to feel improvement. It will be by hemodialysis. What do you think about that? One of two options. Yes, doctor, I accept. So if you accept, you have to sign a consent. Very important, sign of consent in which all the information written,
Yeah.
write it clearly, and if you have any queries, you can contact me by department telephone. Another option, he will refuse. So can I know why you refuse? Anything about you should solve it, or even he refuse. 2 minutes remaining. Yeah, okay. I will involve my consultant. He is right. He can convince you about that. Do you have any concern? I will tell you, doctor, if I not my concern, if I not do dialysis, you will not give me any medication. No, I don't. No, we will give you. There is some medication can decrease potassium, but this medication will work slowly. We have to remove this toxin very fast. So it is best method to remove this toxin by hemodialysis. Okay, I will give you at the end. I will give you some brochure and leaflet about peritoneal dialysis and hemodialysis. Goodbye. But I know Dr. Saad is very old, very long scenario. I know that.
Yes. Also, Dr. Mahmoud, because it didn't mention in the scenario regarding the kidney function test or just
Yes.
the potassium level. That is why I get confused.
Yes, really, this scenario
came.
This scenario by name came to come to my friend in last diet in قصر العيني, named Tariq. The same scenario. Come with him. Discuss with him the different method of dialysis. So if you forget the peritoneal, if you forget even the patient, the surrogate, not tell you about kidney transplant, you have to offer to him the kidney transplant. So we have
Long
three.
scenario.
Sorry, kidney transplant. Yes. So you have to discuss three options: renal replacement therapy, first hemodialysis, peritoneal dialysis, and the advantage and disadvantage of each module, and kidney transplant. There is the three modality. The last scenario came in Kenya. It was the same scenario, I think. A patient also hypertension since 5 years. This outside patient hypertension since 5 years, and now kidney function elevated. So outside our colleague thinking that it will be easy scenario, but when inside the station, they told her about that. No one tell me about the hypertension. It is the cause of my kidney, so I can't judge. It is uncertainty, not error. But I need to ask Dr. Bassem, is this
Also,
Dr.
in this
Belsen.
point,
Yes, yes, this
actually, I
point,
get confused because,
Yes.
I'm
really,
dealing with
really,
it
very
like
confused.
uncertain or.
We have to be sorry only, or sorry and apologize, or sorry and apologize and instant report. What I will say.
It's uncertain, right? You believe what happened to him, but you don't know from where the mistake happened, from GP or from another doctor or from your hospital. I think feeling sorry for that, it's enough. You have to apologize whenever you have a team working with you. But the GP, how do you can apologize on behalf of the GP? Even though if you apologize, it will sound that you are defending him and he was correct, or sorry, no, no. If you said that, means she is right, and you don't know what are the circumstances, right? Is he correct or right? And the GP was mistakenly didn't inform. So you have to say we have to review the file. But I think no apology, as Dr. Sarah said. Usually, our habit we are talking about and explaining about every possible condition to your to everyone, and according to the situation, we will manage. This is our habit. However, we are sorry about your suffering. What happened to you? We can review with your GP, or you can have a chat with him. And if he raised the issue of complaint, yes, it's okay. I can guide you to the office responsible, either PALS, patient advice listen services. They can refer him to the GP surgery, or they can do the process by referring the complaint to the GP surgery against his GP. So it depends on the situation, but mostly you will not apologize. This is not your team mistake. It was the GP mistake, which is not yours. This is my
Yes.
opinion.
So,
But at least feel sorry for him.
mm, yes, not
What,
apologize, apologize, so not instant report, not write instant report.
answer to against whom?
Yes.
He's not unless he said to you, I was here with your team, with your colleague, your doctor in the hospital. If she proved that, or he proved that he was here in your hospital and this happened with you or with him in the hospital, this is a big mistake from the hospital and
I
your colleague.
think, mm,
But if it
Mr. Basha,
happened
I'm sorry.
outside, yes,
I'm sorry, but because it mentioned in the scenario, he has hypertension for 5 years. So it is unlogic. The patient having hypertension for 5 years, he didn't aware
to have
regarding
end
this.
stage renal disease. Yeah, I think the scenario also, while transferring from here to there, some words will be missed.
It might be a mistake, I think, or
Yeah, mistake of what?
mistake because no one told him regarding his he has high blood pressure
Yes, who's that one?
regarding the medications because
Who,
the patient said that just he received medication for a while for high blood
who's
pressure.
okay? Who's that? You assume that it was
Yeah, either is GP
GP.
doctor or yeah.
So you don't have also contact with his GP, direct contact. So you can say we will have a contact with your GP to know exactly what happened, what are the situation. But you cannot assume it was mistakenly by the GP.
In such a scenario, yeah, just we can apologize and raise incidents
I
report
I
and we
don't
can
think
go
also
back to the
apology is
because there is the
necessary,
harm
because
might happen. Mhm.
yes, there is harm. I agree, but is that mistake from your team? We don't know even what the situation, what happened there. Okay, it's uncertain till the end of the scenario. Uncertain what happened exactly. Was he diagnosed
Mhm.
as hypertensive really, or something else ongoing? Maybe he's having polycystic kidney disease, and you don't know what are
Mhm.
the situation. But what you have now is acute setting of renal failure or kidney injury or shutdown, and he need to be on dialysis. For further plan, we will discuss, yes, but you don't know what will happen also. You got it? I don't think the steps of stake will be raised here,
Yeah.
medical error, because you cannot raise it against your GP or his GP. You can raise or you can do these steps, whatever the situation happened in the hospital, against a team working in the hospital. Okay,
Yes, Dr. Bassam, I am with you because might be in the medical file we find that the doctor write in the medical file that
exactly.
the patient should come next week to measure blood
Yeah,
pressure and the patient not come. So I
exactly.
yes, I am with you, Dr. Bassam.
Yeah, always
Just
follow your sense. Yeah,
yes. Okay.
always, yes, be sorry. At least be sorry, but you cannot apologize on behalf of someone you don't work with. I mean, the GP.
Yes,
Okay,
because Dr. Bassam in exam the error come clear error, mislabeled, take
something in the
clonidogrel.
hospital.
Yes,
Yeah,
become clear.
yes, something in the hospital. But outside the hospital, how you can apologize on a mistake on behalf of someone you don't work with him,
Yeah,
and he's
even
not.
apologize just regarding his condition now because he didn't
Yes,
do it.
No,
Dr.
sorry,
Sarah, the
sorry, doctor.
apology, yeah, feeling
Me
sorry is
mistake.
the sympathy. Exactly. The sympathy is fair enough to talk about something harm him. Once you honestly saying, I'm apologizing on this mistake, means you are joined with this mistake. You're involved in this
Mm.
mistake, but you are not involved. How you can apologize on something happened outside your hospital? You will say, I'm sorry, or I apologize on behalf of the GP, which I don't know him. Yes, he is my colleague, but I don't know even what are the situation, what happened there. What maybe, as Dr. Mahmoud said, he had an appointment, he had an advice, but he didn't follow. Maybe he prescribed medication, he didn't take it. Okay, so you don't know what exactly happened, but you are talking now about the acute setting. What will do? The situation will be solved by renal dialysis or renal replacement therapy. Hemodialysis mostly because the peritoneal dialysis will not be effective as. And for the drug itself, also, it's not effective as. Yes, whenever he asks you, yes, doctor, I heard about some medication, or is there any medication, you can say, yes, there is. And this is real, right? There is some medication which is called anti-hyperkalemic measures. However, it will be not only slowly, it will be less effective, and it will be like transient effect. It will not help to remove this potassium or this salt, which is very dangerous on your heart, permanently. The only effective module or method or way is to do the renal replacement therapy, not even the peritoneal, the hemodialysis. In the future, you might be added to a list which is called kidney transplant. If you have any donor, we can make it faster. Otherwise, it will be, or you will be on a list, which takes some times, but you should be involved to this list. Okay? Clear, Dr. Sarah, Dr. Mahmoud?
Yes, clear, Dr. Bassam. I am with you.
Yes,
Yes.
Dr. Thank you.
Okay, let's read your scenario, Dr. Mahmoud. Then I will read the comment and I will discuss with Dr. Emma about this scenario, this concern. Okay, back to the before that, the comment. Sorry, the marks, the judgment. How you can judge for the clinical communication?
Yes, clinical communication satisfactory, but I think in clinical judgment, Dr. San forget the concern,
Yes,
the consent.
Consent,
Sorry.
consent.
yes.
Yeah, the consent. It will be not only in the clinical judgment. It will be in the clinical communication. Clinical
Okay.
judgment for saying a decision, it might harm or it will not help the patient.
Yes,
Okay,
Dr.
for
Bassam.
me also the consent will be minus the clinical communication skills. Along with also whenever you have patient with his father diseased or he had any issue, please ask about him. How is your father now? You ignore every situation regarding his father. Yes, I know he's on dialysis, but you didn't ask how is he. Yes, you said I'm sorry for your father, but you don't know what happened with his father. Okay, try to address it immediately whenever you hear, yes, my father was having the same. Okay, how is your father now? Is he okay? Blah blah blah. And in the beginning, also at the beginning, please, whenever you have patient with acute setting, ask about him. How are you? How do you feel now? Patient is complaining of nausea, vomiting, and vomiting. At least ask once, how do you feel now? Okay. So yeah, it might be borderline in the clinical communication. Clinical judgment, I agree, satisfactory. The concern, did she ask all concern? Not address,
Yes,
ask.
I
She
think
asked
Doctor asked.
about him.
Yes.
And the welfare.
unsatisfactory, Dr. Basim,
Okay.
because she harmed me about my father. She didn't ask about my father.
Yes, I agree, Wallah. I agree. Please.
Yes,
Yes,
I
she
can.
need-
okay. I'm sorry for suffering of your
Yes, but you don't
family.
know what happened to his father. Is he alive?
The time, I have the time
Yes, I know.
for him, not enough.
By the way, Dr. Sarah, the scenario in the exam will not have all this concern. They will give some consent, so try not to talk a lot. Give
Yes.
him a chance to express his concerns. Okay. So again, borderline for the welfare for his father status. Okay, someone commenting GP is one of the team. Okay, Dr. Nada, but in scenario written he had high blood pressure for 5 years. Okay, but he ignored that, or sorry, he denied that he had high blood pressure, or anyone informed him about his blood pressure. GP, yes, I agree. He's one of the team if he has contact with you. But in this situation, I think how you can apologize on behalf of him, and there is a mistake, you are not sure about it. What I mean, don't apologize. He will say that like you are defending him, and you don't know even the situation. At you might make him or it make him more angry whenever you see that. Okay. Yeah, he is one of the team. Whenever you refer him, you refer the patient to him. Then, right, Dr. Mansour, Dr. Ihda, I think, right? Dr. Abbas said, if uncertain error, you said only sorry. Thank you, Dr. Ihda. But if error confirmed of system failure, all steps should be done. This, yes, what we confirm. Dr. Sarah, the scenario, please. Okay, sorry. Clinical communication, okay. Where is the error in the scenario? Is it because of not following the hypertension or what? It wasn't informed, or the patient, what he's saying, pretending that no one informed him about hypertension. So it's uncertain, you don't know what happened exactly. At least feel sorry for him, say, I'm so sorry for your suffering and what happened with you. Usually, we are sharing all information with the patient, we are giving advice, we are taking opinion and the decision and the management plan sharing with the patient. What happened with him? We are not sure. We will review the file. We will have a chat with the GP. But why to apologize? I don't think need to be apologized. Dr. Musab. So we need to question more the issue of uncertainty to seek error or avoid his point by telling we will investigate. Dr. Musab, my advice, don't go through these too much because it will waste your time and you still have a lot of tasks in the scenario. Explaining the end-stage renal disease, explaining the task or the procedure, renal replacement therapy, and the other option of renal replacement therapy, kidney transplant, social support. So just be sorry, we will investigate it, and we will, if he insists to complain, yes, we will refer you, or I will guide you to the office, GP surgery, or the pulse office. Then they can refer him to the GP surgery. That's it. Don't spend a lot of time talking about is it a mistake, what happened exactly, tell me more. No, it will consider like you are asking, taking history. So it's not the time to ask, give me more details about what happened. Just believe on him and say, I will investigate, we will have a chat, we will confirm, or we will investigate it. But I'm so sorry for your suffering. That's it. Okay, back to
I
the
have a
scenario.
question, please.
Yes, sure.
This
Doctor.
scenario is breaking bad news, yeah?
Yeah, definitely. Absolutely right.
But I didn't hear the candidate give
No,
the
no,
golden silence.
she,
Golden
she,
silence.
she did earlier.
That I
She
think
did. She did,
yes.
Dr. Basim, yes.
Yeah, she did. So
دكتور
it's breaking.
Okay.
بس في two concerns البيشنت انتوا صح خلصتوا على البريكنج باد نيوز؟
Yes, yes.
خلص تمام. السيناريو عمله من جديد دكتور عماد، تمام.
Okay.
ففعلا هو كان 5 years اعتقد اللي اخده، حتى اخده منه تقريبا من فترة، عم بيقولوا انه اجى السيناريو، واعتقد هو كمان عمله باخر سيشن. ففي concern انه مو I don't know about hypertension, she admit that she missed follow up for hypertension و she didn't take it seriously. بس الشيء اللي هي she denied إنه nobody has discussed with me the complication of hypertension and that I might end up with losing my kidney.
Yes.
So this is making sense. So the patient will admit the hypertension. Usually we call this يعني it will be easier for you to handle communication misunderstanding or communication errors. Communication errors with uncertainty about how the information was delivered or how clear the information was delivered. Usually we don't issue an incident report. عادة when someone tell you nobody told me about the side effect of this drug or nobody told me about the complication of this disease or nobody mentioned that prognosis of GBS will end up by مثلا residual neurological deficit. فوقت بيكون في communication error usually we make sure from the person who provided the information and we go back to what was documented at the time of the appointment without mentioning any incident report. And all the examples I told you, they are very similar to what will happen between you and the surrogate in this scenario, and you will pass it without an incident report. Just you will have to go back, check the records, check with the doctor who handled the consultation at that time, and as soon as you will collect the information you will come back. مثل ما قلت انت انه from our practice بقى انه usually we explain the details, side effect, we explain the complication, we explain the prognosis, we tell all the possibility. But something went wrong as you are saying, so we will go back and look it up. والشغلة الثانية اللي كنت بدي أقولها الapology. يعني I respect all what you said. Sorry is different from apology. Apology you people connected to the error بينما sorry to the empathy. But if the patient, if the surrogate in front of you is very angry and you are saying sorry well patient is still يعني انت you will feel it انه I'm repeating, I'm saying so. معناتها he's waiting an apology. فsay it. Okay, يعني with the angry patient who is like who gonna lose his kidney and he's for example now I will be into the dilemma of dialysis and I will be attached to the hospital and my life will be up and down. You are not able to calm him down by just saying sorry, I will go back, I will look it up. This mean between two practices waiting an apology. So say it. ما تطول عليك الطريق. على الأقل if you face this solution هيكون apology. يعني فهمت يعني إنه بس at least if you are in this situation so this is could be a solution. Don't stick to sorry, don't stick to defend your colleague. You will be fighting something and the patient is waiting something else. He will not allow you to proceed. For why? I will save my neck. Say I apologize, contain the situation, he will calm down, then you can continue. Usually this would happen. So such a step is awaited to be done by you and the surrogate want an apology. وفي concern حلو كمان ما بعرف إذا أنتوا سألتوا ولا لا لما عمل دكتور عماد السيناريو when he was telling him about the management and the renal replacement therapy modality, so the surrogate asked will this affect my lifespan? So you discussed this concern?
No.
So this was the concern and now he's lost his kidney.
Yes, you're right.
تمام. this was a good concern بصراحة لما عمل دكتور عماد. يلي كان عم يعمل كيس مين if you want to try.
Dr. Sarah, yes. Dr. Sarah, how to address this concern? Will this affect my life or affect my lifespan?
يعني be on RRT.
Yes.
لأنه أنت you have to explain يعني briefly all the RRTs. لأنك you was not given يعني it was not given in the scenario which exact modality to explain. So after you will finish, you will tell you, Doctor, what about my lifespan? Will this affect my lifespan?
How to answer this?
My life
tell you that
expectancy.
yes, if your condition not treated or not controlled well, yes, it can affect your life. And it can short your life.
Yes. Even the dialysis itself, one of the modules that with the complication of dialysis, it might happen and it might threat your life. Even missing dialysis. Yeah. all
to
these things,
encourage him to start the dialysis.
ischemic heart disease, all that.
Let's be slightly يعني into you people you made it يعني you made it very difficult for the patient.
Okay.
Patient is now going for dialysis, lost his kidney, and you will tell him that your life expectancy also will be shortened. So this is like, do you know, يعني as if it's مو بس breaking bad news, يعني it become like something very bad. So he will not live an even near normal life. بس نحن between two brackets بنعرف إنه في لاعبين كرة قدم they are on dialysis. صح؟ يعني مرة وقت كنا بالدياليسز ماشيين فكنا هيك وجوهنا شفقانة على المرضى، فأجا الدكتور فاجأنا قال أنا عندي مرضى على دياليسز بيلعبوا كرة قدم وفي منهم أثليتكس وفي منهم بيعملوا هايكينج و they are living near normal life span near normal life يعني near normal life as a quality of life. طيب هلا أنا I know that there is a premature
I think yes, it's difficult, Dr. him to say that to
لا
a
أنا
patient who go
I would
3 times.
be slightly neutral إنه now we are offering you something which will replace the function of the damaged kidney, and if we start this as soon as possible and in the future we find a way after the dialysis to give you a kidney, you might be able to have a near normal life if you are compliant and doing your best to follow the medical instruction. But don't mean that you might not suffer a complication. Okay?
Okay,
يعني
but
أنا إذا سألتك مين أوقع مين هيك حسيتك مرتاح أنت لإلها، الكومبليكيشن واردة وإنها
yes,
to have a near normal life واردة، صح؟ We
yes,
know
but
that people they
the
cancel
most common even due to uremia, due to even the complication of dialysis, the anemia.
بس
But difficult to play football or to have even his normal job, he will not be able to do it. So
هلا شوف
I'm talking about, for example,
I agree with
soldier.
you بس يعني بالنهاية
I
كان
think
جواب
it will be
دكتور
like
أيمن
false hope.
إنه
I don't think it will be like false hope that he will be even near normal life. I didn't see any patient with dialysis or on dialysis.
المهم نحن وقت كنا بدياليسيس أنا سمعتها قبل هيك ودكتور عماد وقت حكاها قال yes if you follow the medical instruction and this was done urgently and in the future we were able to manage for you a kidney transplant, you might have a near normal life, but you have to be very careful from the complication because like any treatment there is a complication. فهو
Yes.
جوابها yes إنه there is a possibility to have a near normal life بس you have to do this urgently لأنه هي كانت بالبداية يعني trying to run away from the RRT إنه what if my kidney recover, what if my يعني
Yes.
he told her إنه no this should be done urgently to avoid يعني worsening of your parameters أكتر من هيك يعني.
I think it was for tumor lysis syndrome or rhabdomyolysis patients. I heard this scenario before. Patient might be either to be on short-term dialysis until the recovery of the kidney, or
short term
he will be.
dialysis agree معك هذا مختلف هذا مثل
Yes.
سيناريو
So we don't know here
جنساماين.
what the scenario. This is
لا
what I mean.
السيناريو كان تبعه hypertension مثل تبعكم hypertension و not diagnosed مو not diagnosed she missed the follow up she came now with the shrunken kidney.
Okay, so we'll be neutral as you said, not to have
shrunken kidney I think shrunken disease yes I have.
Yes, already atrophied. So
Yeah.
it will not be as giving the all good hope and the same time not.
patient كان عمرها 32 تمام ف 32 to tell her it will short your life expectancy she's still young. يعني sometimes really يعني I think إنه if you get an examiner who is too careful about the feeling of the surrogate and you were very strict about telling her just about the complication and she get more and more upset يعني you will be in critical situation. فبي let's say يعني be vigilant شو وضع السيروجيت شو عمرها يعني and take care of this. تمام.
Okay. Yes. Okay. Thank you, Dr. Hen.
You must.
Again, I will try to be neutral, not to be as too much depressing news and not to be as false hope. And to be neutral in between, the best way with any situation, not only this situation or this concern. Okay.
I think in this scenario, Dr. Wasim, because already the patient hyperkalemia and can affect the heart like this, it's serious condition, and just to try to convince him regarding hemodialysis. So if this concern raised, yeah, I think if not controlled or not treated, it can affect his life.
Yes, of course. Plus even the compliance to the sessions. If he miss any session, he might.
هي سؤالها is not about the current situation. Current situation is critical, and we are telling her that we want to do urgent dialysis. She's asking about the future. Now I lost my kidney, or I missed something. So the future.
Okay. Regarding this,
She's asking, yes, يعني exactly when when you will receive this concern, it will be at the end of the scenario, and she will tell you, طب doctor, my lifespan, my life expectancy, with all those modality that you explained. فهي حتى ما عم تحكي على الكرنت تريتمنت. نحن بالبداية شرحنا لها now we want to go urgent. هلا هي عم تسألك كأنه future after those RRT modality, whether dialysis, whether peritoneal, whether liver transplant. وكمان بسبب وجود الليفر ترانسبلانت this is more، يعني انت كمان عم تشرح 3 modality، فانت you don't know whether she will find a donor. وانت قلت انت قلت قبل شوي انه we will put you on a list. if كمان يعني it work with us and we were able to arrange for you، هذا كمان will improve. I mean يعني give the positivity and give the negativity. يعني why you forget انه الرينال طب transplant will improve her lifespan. طب this
Yes.
يعني this worth mentioning، صح ولا لا؟
Yes,
you
yes.
يعني you are going to put her on a list you will start the dialysis urgently. I mean
normal life.
يعني don't make it too much black، لأنه أنتوا جاوبتوها قبل شوي وقت أنا سألتكم.
No, no, it was like clinical judgment rather than discussing or addressing concern. I talk about the clinical part of the this concern. Will he be as near normal life? I said that there is complication, there is uremia, there is anemia. He will be.
But also take care of him as a person.
Yes. So after every bad news, you have to reassure him that we will do our best to have good
we'll try
quality.
to avoid the complication. We'll try to
Yes, exactly.
yes, do our best so you get a donor as early as possible.
You will not be alone in this journey. We will be with you all over like this.
And
Yes.
if things مثلا went good and we were able to arrange and you did all the sessions on time and you are young مثلا, so things might go on fairly well. يعني أي كلمة تحسسها إنه يعني still she can do something in life.
Yeah, the reassurance may be the good thing to do and to offer. I agree not to give also this again the false hope, because I think I never saw a patient on dialysis. He's doing fine. Yes, he can be near normal if he was on compliant to the dialysis, but still he feel a lot of complication, ischemic heart disease, the arrhythmia, the electrolyte disturbance.
مع الوقت أنا معك.
Exactly.
يعني
Yes.
حتى even if he's a compliant person, it will be the hardest thing.
Exactly. Yes.
Incorrect.
So you will try, but not as false hope. Don't say yes, everything will be okay. You will have.
لا مو لهالدرجة، بس يعني
okay.
in consideration that she's
To take care.
يعني
Yes.
she's young.
Cautiously, yes. Try to do it cautiously. Don't give as a good hope. Okay. Clear now for all? Dr. Mahmoud, I will read your scenario before. Yes, where is the scenario? Okay. You are the senior house officer in the acute medical unit. Mr. David, 31 years old, preferred with progressive lower limb weakness in ascending manner. Started eight days ago. Seen by medical team and work up done in the form of analysis, CSF analysis, nerve conduction study, confirmed Guillain-Barré syndrome. Talk to him, explain the diagnosis, address the concern. Sorry, Dr. Ima, because of the long discussion, we can do the concern for the next scenario. I think we covered the all concern in the previous scenario. So we will do the concern for the next scenario, Dr. Ima, okay? Dr. Mahmoud, you are ready?
Yes, doctor, I'm ready.
Okay, here you go.
Okay, good morning. I'm Dr. Mahmoud, doctor in the senior house officer in the medical unit today. Let me confirm you are Mr. Davis, 31 years old.
Sorry. Yes, doctor. Yes.
Yes, Mr. David, we are here to discuss about your recent complaint. Is it okay with you?
Yes, doctor.
Okay, before I start, Mr. David, can you tell me how much you know about your condition to be in the same page, please?
Yes, doctor. Actually, before 8 days ago, doctor, I have been suffering from weakness. It started for me from my feet and coming in ascending manner. So I came here, doctor, and we did for me some test. Now I want for me what happened.
I am really sorry for your suffering, Mr. David. Mr. David, how do you feel now?
Yes, doctor. Just I'm worried regarding my condition.
Okay, do you have any expectation? Do you expect anything from our meeting today?
Yes, doctor. I think because of my friend, one of my friend having weakness, they diagnosed him as having multiple sclerosis. So, doctor, I have multiple sclerosis like my friend.
Okay, I'm sorry for your suffering of your friend, but Mr. David, you are not, you don't have multiple sclerosis, but actually your blood test and your the result of tissue sample that we are taking has been revealed, and I'm sorry, I have not good news for you today.
Oh, doctor, what I have, doctor?
Mr. David, actually you have a nerve problem. It is called the Guillain-Barré syndrome. Do you have ever heard about that?
Never, doctor, never.
Okay, let me explain more about this condition.
Yes, please.
Okay, Mr. David, Guillain-Barré syndrome. It is a medical condition which causes nerve problem. Actually, it is a disease of a problem in your defense system, which is supposed to attack the bugs. In your condition, it is mistaken attack the nerve cable. That's why you have muscle weakness. How do you think about that?
Oh, doctor, so this condition is it serious, doctor?
I am really sorry for this bad news today, Mr. David, and I do understand your worries. Yes, Mr. David, it is serious condition if not treated well.
So why this condition come for me, doctor?
Yes, actually, Mr. David, this condition is a problem in the defense system, which is supposed to attack the bugs. And in your condition, it mistaken attacks the nerve cable. This condition is can be triggered by any triggers like any loose motion. So can I ask you, do you have any loose motion in the preceding days?
Yes, doctor. I think before 2 weeks, doctor, I have loose motion, yeah.
I'm sorry for that, Mr. David. One might be the cause. So let me discuss with you what we are going to do.
Okay.
Okay, Mr. David, we will admit you. We have to monitor you because this disease can affect, as I told you, affect the muscle of your leg, cause its weakness. And it sometimes, if not treated well, it can affect the muscle of swallowing and also muscle of breathing. That's why we have to admit you and monitor you in our ward. And also to measure, do another test. It is called a blood test, which can measure which this disease affect your the muscle of breathing. And if it affects the muscle of breathing, we have to admit you in the critical care unit to take full care plan. At this point, anything not clear, Mr. David? Do you want anything to explain
Yes,
more?
doctor. So, so any treatment, doctor, anything that can help my condition?
Yes, Mr. David, what we are going to do now, I will make a group of specialists composed of physiotherapy and occupational therapy and the nerve doctor and also nutritional and the dietitian. And also may have a help from our team, which is SWOLT team. And according to the decision of nerve doctor, we have many options. One of them, we can give you a medication called immunoglobulin. It is a medication given through blood channel. This medication can help you to correct your defense system. And as a medicine, it also has some bad effect, like may have fever, may have rash, may affect your blood pressure. That's why we will monitor you, and if you have any complication, we can deal with it. And there is another option. If this medication not help you, we can provide, we can give you another module of treatment. It is called plasma exchange. Plasma exchange, Mr. David, simply it is a machine which can help us, can help you by filtering of your blood, can remove the bad protein, harmful protein from your blood. At this point, we have you have to sign a consent to give you this treatment. Anything not clear, Mr. David? Do you want do you have any concern till now?
Yeah, doctor, which option is better for me? Is better for me, doctor?
Yes, I do understand your concern, Mr. David. It's according to our nerve doctor. Just why we have to admit you in the hospital and monitor your breathing and your swallowing. We will give you treatment as soon as possible, according to the decision of nerve doctor. Okay, Mr. David, do you have any concern?
Okay, doctor. Actually, doctor, I'm thinking regarding MS, doctor. So why it is not MS?
Yes, I do understand your concern, Mr. David. Actually, when you admitted in the hospital, we do some blood test and also nerve tracing, and we take a fluid tissue fluid sample from your back, and this given up the diagnosis of Guillain-Barré. Multiple sclerosis is another condition, can also shown in the tissue, the fluid sample, which was taken from your back. So it is not multiple sclerosis, Mr. David.
Okay, doctor.
Do you have any concern, Mr. David?
Yes, doctor. So actually, I have some ceremony, doctor, to my daughter. So I want to travel after 2 weeks. So can be able to be travel.
At the beginning, Mr. David, congratulations to your daughter, and congratulations for her harmony. But I am afraid, Mr. David, I am sorry, you might not be able to attend this harmony. Because the treatment might take in a few weeks. Actually, the treatment may take in from 2 weeks up to 6 weeks. So I'm sorry you can't attend this meeting. We can have a discussion with your daughter. She can postpone this harmony, or you can attend this harmony by video call or like that. How does that sound with you?
Okay, doctor. You mean that after 6 weeks, I can come back to my normal doctor, and this weakness can be recovered?
I do understand your words, Mr. David, but this disease outcome it varies from one patient to another. Most majority of the patient, above 80%, can improve and return to their normal. But I'm sorry to you that some patient can be complete his life with this ability.
1 minute left.
I am sorry for that, Mr. David, but I have to be honest with you. So can I ask you with whom you are living?
Yes, I live with my family, doctor.
Does anyone dependent on you, on your family?
Yes, doctor, I have kids and my wife.
I'm sorry for that, Mr. David. But anyone can help your family, or you need any support?
Yes, doctor, I need support because no one.
Okay, Mr. David, I can involve a social worker. They can help you about this issue. What do you do for a living?
Yes, doctor, I'm a driver.
Okay, Mr. David, you have to stop driving at the time being, and also we will assist you after improvement if you have ability to drive or not. Okay, time finished.
Okay, perfect. You finish on time. Any concern, Dr. Sarah?
No.
Okay, Dr. Mahmoud, thank you. Well done. Dr. Sarah, you can comment based on the skills.
Yes. Dr. Mahmoud, he did well. I think all the skill is perfect. Just I have a comment regarding the concern. Yeah, I want to travel 2 weeks ago. So regarding the weakness itself, not a weeks, 2 to 6 weeks, just more for 6 to 12 months. It need more long time. And this will depend according to the severity of the conditions and response to the to the plan of care, like physiotherapist. Yes, apart from that, you mentioned everything in the right way.
Okay, thank you,
Thank
Dr.
you so
Sarah.
much.
Thank you. I agree regarding the duration and the percentage, Dr. Mahmoud. You mentioned 80. I'm not sure what number you mentioned.
Yes, the percentage. No, yeah.
80%.
Okay, I'm not sure also
Not
about the
mentioned in
number,
the
but
scenario, so no need to mention it.
yeah,
Most
better not
most
And majority
speak
or
about.
a minority of cases.
Yeah, no need to talk about or to give any accurate number as a prognosis or outcome, as long as you are not sure. If you are sure, and even if you are sure, better not to mention any number. You don't know
yes.
from what type of this patient is having. Is it it's aggressive type or advanced or just mild one? You don't know. The other thing here, yes, you talk history. You ask a question like taking history. Do you have diarrhea or something preceding? Which is, I think this is considered as taking history. You can say it, and he will volunteer to say, yes, I had gastroenteritis 2 days or 2 weeks ago, without asking, do you have any of these before? Not only this scenario, any scenario with those risk factors, and you want to enumerate, yes, it's enough to enumerate, and he will tell you definitely, yes, I had this or I had that. But if you ask, maybe they will comment that you talk history, which is against the communication scenario. Enough to enumerate the risk factor or the preceding condition or something might be related, particularly the medical part of the scenario. And here's in this scenario, the diarrhea, of course, as we know, Campylobacter related trigger, but if you ask, it will be considered. So the best way, there is possibility in some patients after having infection in their gut, they might have this weakness and the defense system might be attacking our nerves instead of the bugs, particularly after this infection. And then he will be saying, yes, doctor, you are right. I had this infection 2 days ago, 3 days, 2 weeks, whatever. Don't ever ask if you have it before. Okay?
Yes, Dr. Bess.
Yeah, otherwise, so it will minus you in the clinical communication. Otherwise, yes, you address it well. For plasmapheresis, I agree to ask for consent. Doctor, someone asked in the chat box, is it necessary to ask? Yes, plasmapheresis with the procedure and connecting to machine, it's like RRT or the renal replacement therapy or hemodialysis. So you have to get a consent and explain about the procedure briefly, not in details, because you have a lot of tasks in this scenario. Okay. Anyone want to comment? Dr. Sarah, Dr. Mahmoud first.
Thank you, Dr. Bess. Thank you very much. Thank you, Dr. Sarah.
Okay.
Thank you, Dr. Bhatt and Dr. Mahmoud.
Okay, and we will go now to Dr. Emma because I promised him he will address the concern with me in this scenario. Dr. Emma, are you ready? Emeka? How to call your name, Dr. Emmy or Emeka? I think he left.
Hello, Dr. Basim, is Henry.
Henry, no, I think also Dr. Emeka asked me the previous scenario, or you are the one?
Yeah, I'm
Henry,
the same person. Yeah, but actually, I was not following up in this scenario. I was quite busy. I didn't follow up with this particular scenario. Maybe next time, sorry.
No problem, no worry.
Sorry.
It's okay, Dr. Henry. So the same person, Dr. Hena and Dr. Emma are the same?
Yeah,
Oh.
it's the same person.
Okay, thank you, Dr. Emma.
Thank you.
Anyone want to add a comment or ask a question? You can listen to the record, Dr. Henry. You will know more about this scenario because
All right,
it's
thank you so much.
very common scenario. Guillain-Barré, multiple sclerosis. To explain to counsel, it comes. Okay. Let's talk about the multiple sclerosis option in this scenario. Is it, as Dr. Mahmoud said, yes, we have confirmed this by doing the snip from your back. We also, the presentation is different. That's it. If insist to know more, yes, I can explain to you more. The type of weakness will be stiffy, and this in your condition, the weakness will be floppy one, and this is the major difference and golden difference. So no need to explain more and to give more details. If he asks, you can do how to distinguish between both in a brief way also. Okay, for the prognosis in the long term, yes, there is possibility to be recurrence. I'm sorry about the flight. I cannot give you any promise. It's difficult. We should assess you from time to time along with the physiotherapy. If you are okay and everything is okay, we can reassess you again. Don't give any hope that yes, he might or she might be okay 100%. You don't know even the recurrence rate of there is possibility for recurrence, and you don't know if she will be under the recurrence rate and this condition or this or the relapse might happen later on. So if she asks clearly for the plan, we don't know now yet. We will reassess you from time to time. We will follow you, and whenever you are okay and suitable to fly, we will let you know. Okay. These are the concern I think we wrote here down. And any other concern? Any missed concern we didn't discuss or repeat? Yeah, why it's not MS? We mentioned any treatment. Yes, the option already mentioned. IVIG and plasmapheresis. The IVIG, the main action, it will neutralize the antibodies or the toxins, which is protein that attacking our body. If you want to explain, otherwise it's one of the indication will be prescribed in the best interest of your condition, and plasmapheresis as a second line. The SOL team is very important. Dr. Mahmoud, I think, also involved regarding the swallowing, yes, the breathing, and you should be monitored sometimes in the critical care unit, which is advanced area for critical situation. You might be connected to a machine for the breathing support once the breathing is affected. Can I travel? Okay, 2 weeks. Don't give any duration. Don't give any percentage for the recovery, recurrence. Everything make it as possible, high possible, likely. All these words you can use, but don't give accurate number. 10% you might have recurrence. Don't say any number, okay? I think these are the concern and simply and shortly how to address. Anyone want to add any suggestion, any point to be clarified? Any question?
Dr.
So,
Basim, Salaam
yes.
alaikum.
Alaikum assalam, yes. Dr. Saad.
What if the patient asked me about the travel and I told him, no, you cannot travel right now
Okay.
because of treatment. What if he said he can just prepare there in that place his medications and his
Okay, good question. Yes. So at least to be prepared there, and not only that, we have to be sure that even the flight you are amenable to do, or is it suitable for you? Because even during the flight, he might have the relapse and he might deteriorate. You don't know what will happen. Maybe the trip is longer. Maybe it will be short. We don't know what will happen. Again, yes, let he arrange everything there. And before deciding for that, we will reassess you and we will let you know. But at least he did this step in advance to prepare everything there, which is good solution. Now we are talking about the flight itself. is it safe to have a flight in his condition or to postpone? So we will assess it after giving you the medication and along with the group of doctors. If you are okay, we will let you know. Okay.
Okay. Thank you.
Awesome. Any other concern? Any question? Clear for all? Okay. Thank you, Dr. Mahmoud, Dr. Sarah.
I have a question, please.
Yes, sure.
If we don't have exactly if the patient fit for fly or that, what should we say?
Again,
For any case, I mean, not for this only.
yes,
general.
again, in general, any condition you are not sure about his safety during the trip, tell him we have to re-evaluate you, reassess your condition, and along with the doctors, don't put it only in your responsibility. Put it with others, because this is one of the multi-system affection disease, right? Even other condition. So we are not sure if he will be safe during the trip, or he might have something might happen as a complication. It's serious, it's very serious to say, yes, it's okay to travel, and you don't know what will happen during the trip or the flight. Maybe there is regulation regarding the flight. The flight will not accept, the airlines will not accept. He should have fitness paper. So the best answer is to re-evaluate the patient after receiving the treatment. And if he is okay, we will let you know. Okay, our aim is to have a safe trip. This is what also in the practice. You cannot allow any patient to travel if he's having any danger or if he is having any risk during the travel or the flight or whatever, right? Unless he asks you, yes, doctor, I will go on my responsibility. That time you can talk about a consultant meeting, and at the end you can let him sign the DAMA paper. Why you are doing that? For your safety now. Anything will happen to the patient, you already inform him, you give him the precaution, and you already told him about the possible risk and the complication might happen, and you will be safe at that time. Okay?
Okay.
Of course, there is certain scenarios regarding the flight as pneumothorax, for example. Pneumothorax, it comes in every diet. There is, I think, 6 weeks for the pilot and 2 weeks for the passenger. At least know this duration. If you are not sure about them, you have any doubt, tell him, we will reassess you, or we will refer you to the team, or my senior, I will ask my senior, I will ask my consultant. But as brief, 6 weeks for the pilot, if he has pneumothorax, first time, and for the passenger, 2 weeks after recovery, and doing chest X-ray to confirm there is no pneumothorax. This is in summary, but there is a lot of details you might face during the scenario. Okay? Anyone want a question again? Clear for all? Okay, thank you. Thank you, Dr. Mahmoud, Dr. Sarah, and Dr. Hind, as usual, for the comments, for the interaction, and everyone commented, asked. See you tomorrow, inshallah, the long clinical consultation day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
وعليكم السلام ورحمة الله وبركاته.